the people who are exposed to pollution and they are smoker also. So the pollution does not cause an increased incidence of heart disease in the smoker. Obviously, because the smokers are already affected by the pollutants.
With this smog around, chances of pneumonia and other infections are also increasing, and many cases of pneumonia are coming to us.
Constant or chronic exposure to air pollution can lead to COPDs also, and increased exposure to air pollution can even lead to lung cancer.
As we are aware that air pollution is measured because of two particles. One we call 2.5 and other we can call PM10. So it is basically PM 2.5 and nitric oxide, which are very small, and then they travel all the way to the inside airways of our lungs, and then they get absorbed in the blood. So it is there which they cause main damage. So what persistent exposure to increased pollution, especially to PM 2.5 and nitrogen oxide, that the people who are exposed to prolonged level of 2.5 and nitrogen oxide, they have increased speed of deposition of these plaques inside their arteries, and they are more prone to heart attack and angina. And you can relate it to that basically the effects are same as to the smoker. There is another study where it was observed that the people who are exposed to pollution and they are smoker also. So the pollution does not cause an increased incidence of heart disease in the smoker. Obviously, because the smokers are already affected by the pollutants which they are smoking.
With this smog which comes into the picture, all type of respiratory problems are on an increase. Whether we say those people who in the past also were suffering from breathing issues like asthma, bronchitis, their symptoms are increasing. They're coming to our OPDs, to our emergencies in severe breathing issues. Apart from that, even people who were never having any issues are having lot of problems like runny nose, lot of sneezing, nose block, throat irritation, constant persistent cough, and even breathing difficulties. And I would also like to add that with this smog around, chances of pneumonia and other infections are also increasing, and many cases of pneumonia are coming to us.
Are you seeing patients landing up in ICUs also because of this?
Yes, we have patients who were previously having mild asthma, who are well controlled on medicine. They are coming to us, even with injections they are not feeling good, and we have to admit them in ICUs. Their oxygen is falling like anything. So it's a very precarious situation right now.
We have seen an increase in the number of outpatients who have been coming to us with increased itching of the eyes or throat itching and running nose, nose block, and breathlessness. What is important is the cough is not stopping, the breathlessness is increasing, and the wheezing is increasing.
Sir, what are the major issues that people are facing because of this pollution?
So the major issues that we have seen is the increased number of outpatients who have been coming to us with increased cough with sputum productions, increased breathlessness, increased wheezing, especially those patients who have never had these symptoms before. So already those patients who have bronchial asthma, COPD, interstitial lung disease, they are coming with either pneumonias or increased wheezing. We have to put them on steroids or nebulizations. So lot of patients are having lot of sufferings due to increased air pollution. Constant or chronic exposure to air pollution can lead to COPDs also, and increased exposure to air pollution can even lead to lung cancer. Studies have shown that many patients can develop new onset pneumonias, increased incidence of tuberculosis due to the constant exposure to air pollution. Coming on to the cardiovascular diseases, lot of patients can develop MIs or dysrhythmias or CHFs due to cardiovascular diseases. Newer strokes can happen due to the constant exposure to air pollution.